There are some major changes coming to the Medicare prescription drug payment plan in 2025 that you need to know about. We're going to talk about the $2,000 max out of pocket. Also, we're going to talk about the donut hole going away, completely gone, no more. You're not going to see it anymore. And even more exciting, you will be able to go to the pharmacy counter next year, walk out with your medications and pull out no credit cards, pull out no money. You can literally walk away with your drugs and pay nothing out of your pocket. If this sounds of interest to you, I invite you to stay tuned for the rest of this video. All right, let's dive right in. Two things that I mentioned earlier we're going to put together, and that's going to be the $2,000 max out of pocket and then the elimination of the donut hole. I think they kind of go together in order for you to be able to understand what we're talking about. So, $2,000 is the max that you as a Medicare beneficiary will pay out of your pocket in 2025. As you can see on this other slide that I'm going to put up, in 2023, that max out of pocket was somewhere around $3,100. For 2024, it was around $3,250. And then for 2025, it's set at a max of $2,000. So what that means is when it comes to your prescription drugs, you're never going to be expected to pay more than $2,000 out of your pocket. Now, we're not going to go into what all goes into this amount because it's not necessarily everything that you pull out of your pocket. It could be what others pay on your behalf. There are 4 phases. Remember, we have the deductible phase, we have the initial coverage limit phase, we had the donut hole, and then we had catastrophic. All before 2025, whenever somebody got into the donut hole, they actually had to pay 25% of the cost of their drugs. Manufacturer for brand name drugs actually paid 70% of the cost. So what's going to happen next year in 2025, this donut hole is going away. And so what's going to happen is now when you get a brand name drug in the ICL phase, the manufacturer is going to pay 10% of the cost of that drug. And then whenever you get the catastrophic, the drug manufacturer is going to pay 20% of the cost of that drug. So instead of just paying the 70% during the donut hole, whenever you hit it, they're now going to pay 10% during the initial coverage and 20% during catastrophic. Now, the good thing for you is you're going to pay your deductible, which is 100% of the drug cost if you have a deductible. During the ICL, you're just going to pay your regular copays, and then during catastrophic, you're going to pay absolutely nothing. Okay, so that's the $2,000 out of pocket, and the donut hole is going away. So this is pretty good news. That is pretty exciting, all right? So let's look at this example that I have on the board here. So here's an example that I have. If you watched our video on the drug price negotiations, we used the drug Xarelto as an example, and it had a list price of $517, but just to make it easy, we're going to make it $500. And remember, we've got a $2,000 max out of pocket for our 2020, starting in 2025. Okay, so let's say that this person has a $500 deductible. So in January 2025, when they fill it, they're going to pay the first $500 for this Xarelto. And then let's say the copay after that's $100, okay? And so they're going to keep paying this one $100 until they reach $2,000 out of pocket. So we could pretty much say 500 minus this 50, they'd have to fill this 15 times. There's not enough months, of course, for them to get 15 times, so they're not going to reach this $2,000 out of pocket. Let's say that this copay was $300. So let's say the copay was $300. Then they would only be responsible for 500 minus this is 2,000, it's 1,500. They'd only have to get this 5 times. So February, March, April, May, June. So by July, this person would potentially have met their $2,000 out of pocket, and they would then be in catastrophic where they would pay $0, okay? So this is just an example of showing you how the $2,000 max out of pocket works without a donut hole in place, okay? Now, what I want to talk about next is what we're calling M3P, and that stands for the Medicare Prescription Payment Plan. So whenever I told you earlier in the video that you can go to the pharmacy, you can get this drug, your deductible is $500, and you do not have to pay this $500 at the pharmacy counter. And you're probably saying, Renata, what? Like, so who's gonna pay it? All right, so here's what happens. The $500, the insurance plan is going to make that payment to the pharmacy on your behalf. However, if you opt into this new program called the Medicare Prescription Payment Plan, or M3P, you're then going to make that payment back to the plan. Now, you do not have to make it all at once. You're going to make it in monthly installments for the rest of the plan year, okay? So let's go over that in some more detail. All right, so the Medicare Prescription Payment Plan, M3P, is a voluntary program that you can opt into starting 1/1/2025. You can actually make your election as soon as October the 15th once annual enrollment period starts. And so what happens is there are certain people that are going to be likely to benefit from opting into M3P. And these are going to be people who have very high co-pays or co-insurance at the pharmacy counter. So if you go to the pharmacy counter and your drug's only $5 or $10 or $20 and you don't have any trouble paying that, then this program is probably not going to be for you. However, if you have very high cost shares that you have to pay for your drugs at the pharmacy counter, and it's kind of difficult for you to always have to pay them, then this program will likely benefit you. And so what happens is, let's use that example where we had the $500 drug during the deductible phase. And that occurred in January. What's going to happen is you'll be able to take this $500 and split it out across the 12 months, okay? And so because you're able to do that, you can make the payments to the plan for less than what you would have had to pay at the pharmacy counter the day that you picked it up. Okay, so therefore you're likely to benefit because the monthly payment that you're going to make on this $500 to the plan is going to be less than the $500 that you would have been responsible for the day that you actually would have picked it up at the pharmacy counter. Now, when you go back to the pharmacy in February and you get another refill and it's $100, this $100 is also not going to come out of your pocket at the pharmacy counter. It's going to get added to this $500 that you already had, and then that's also going to get split out across the rest of the months that's left in the year. So your bill may increase as you get more prescriptions, but remember, the max out of pocket is $2,000. So that's how that comes back into play. So it's not like your bill is going to accumulate and accumulate and accumulate. It can accumulate no higher than the $2,000, which is the cap for the maximum out of pocket for 2025. Now, I'm not going to go into the calculation piece for M3P in this video. I am going to do a separate one on that one because it can get a little complicated. The thing is for you to know that you do not have to pay anything at the pharmacy counter. If they're low-cost drugs and you've already opted into this program, unless it's $0, you still want the pharmacy to process your claim through this M3P program. So they're going to bill your insurance. The insurance is going to send that pharmacy back some information that says, hey, this person's already opted into this program. Here's the information to bill that to us, and you're going to walk out the pharmacy with no copay, but you will receive a bill from the actual insurance plan. This program, again, is good for people who may have high drug costs. So if your drugs are very expensive, even if from a Medicare standpoint, you're on a fixed income and you may only get your check on the 1st of the month or the 3rd Wednesday of the month or the 2nd Tuesday of the month. And so your prescriptions may not always line up with when you actually get your check. So even if your drug spends $200 a month, cumulative, instead of having to pay that each and every time, you may not have it because it may not line up with your check. And you may only want to pay it whenever you receive your check. This is going to give you that option because now you can go to the pharmacy, pick up the prescriptions that you need, and know that you can actually pay for them whenever you get your check every month. So it's just another flexible payment plan. Now, Please note, this is not a cost savings. You're not going to save any money by opting in to M3P. It is not a cost savings plan. It is literally just a way for you to spread out the cost share that you would have been responsible for at the pharmacy counter across the entire plan year. Now, the other key component is this is January to December of a plan year. If you opt into Medicare or this program in June, then it's June through December, okay? So it's not a full 12 months, it's just the plan year. You can opt in during annual enrollment, which starts October the 15th, and that will go live January the 1st. Or if you say, well, I'm not really on any high cost medications, I don't need this program, but maybe in May, the doctor prescribes you something and it has a high cost share, you can opt into the program during the year by calling your insurance plan and inquiring about the M3P program, and you can get enrolled then or opt in then. So I hope you found this video very helpful on the new $2,000 max out of pocket for 2025, the donut hole going away, and the option for you to walk away from the pharmacy counter not paying anything because you opted into M3P, and you're going to make your cost share payment to your plan versus the pharmacy. If you found this helpful, please drop a comment below. If you have any questions, please let us know.